We are winding down here with Mice TV at the end of day one of the Cake and Pie Expo, but we've saved some of the best for last. We are off to Latin America with a documentary we've put together called Challenges and Opportunities for Eye Care in Latin America. Our first video is a chance that I got to sit down with Dr. Hudson Nakamura of Retin Awesome. Let's roll that tape. Welcome to Mice TV. We are here with Dr. Hudson Nakamura from Brazil to talk about challenges and opportunities for eye care in Latin America. How are you doing today, Dr. Nakamura?
I'm doing pretty good. It's a great pleasure to be here with you and talking about such a very interesting subject.
Let's talk about some of the opportunities that have presented themselves in Brazil for both patients and doctors in the last 20 years.
We remember years ago in ophthalmology, we used to do surgeries with 20 gauge, 19 gauge size of the probe for doing a vitrectomy for a retinal detachment, for example. And now we reached to 27 gauge. It's a much better technology. We had for surgeries cuts for vitreoretinal surgery of 800 cuts and 1,000 cuts, and we can reach today 1,500 cuts and 10,000 cuts and even more. The speed of the cutters and the size and the technology got so much better that we are doing much better work as well. And now our vitrectomies, they last maybe half an hour.
Definitely sounds like Brazil is benefiting from just wider availability of technology. So it actually, we saw in Latin America overall about 135,000 vitrectomies, really, really high compared to other regions with similar socioeconomic development and populations. You're a vitreoretinal specialist. Why do you think this level of penetration exists in Brazil?
Yeah, we have here in Brazil a system that we call SUS, the well-developed system for healthcare. I'm here in the iBank Foundation. We do private patients, we do patients from insurance, we do government patients, and we do lots of things. And the same treatment the private patient receives, the patient from the government receives as well. So we keep the OR virtually very packed all day, and we have lots of patients to take care of.
These great results are, of course, as you mentioned, the result of technology, but let's talk about patient education. What role do you think patient education plays in this uptrend in surgeries and adoption of medication and things like that?
The main thing is that you tell the patient from the medical relation standpoint, looking at his eye and telling him, explaining what his surgery is about. So that plays a major role. And of course, because of websites, of course, for each patient, there is not a fast rule for some disease and how to operate and what to do. The patient has to understand and comply with our information in such a way that he learns what to do and what will be done, and whether he gets a refractive surgery or a retinal detachment surgery, one can interrelate to the other, and so the patient can have all his problems solved depending on his particular case.
We talked about technology as a big opener of opportunity, and we've talked about patient education. Let's boomerang back around a little bit and talk about doctor or surgeon education, which I think is something that you have a particular interest in. You have your website, Retin Awesome. What role do websites like yours play in educating surgeons? Because with technology, if you have the technology and no one knows how to use it, there really isn't any use for it.
If you get to the retinawesome.net website, you're going to see that we are involved with many other partners. We don't produce the content for ourselves and for displaying our service and whatever things similar to that. We like to show and display whatever tells people and teach people how to learn of vitreoretinal surgery, of clinical retina. Whatever you do here, like me, I do surgery one way, and somebody from Singapore, like my friend Gerard Chouard from Singapore, he does a different way of retina surgery. Dr. Lam, and so he, plays a major role in teaching vitreoretinal surgery there. We are having Peter Kaiser in the next Retinosom meeting next August 27. So we learn with each other. That's the main thing of teaching vitreoretinal surgery, ophthalmology.
You have a lot of opportunities opening up in Brazil in the last 35 years, as you've mentioned, because of all these things, patient education, doctor education. Let's shift gears a little bit and talk about some of the challenges facing the Brazilian ophthalmology landscape.
We know that economics, they play a major role. And even though we have the possibilities of this technology, we cannot afford with maybe the best of it in all places. So it's not something homogeneous, but it's going to be, because technology is arriving and the prices are getting to a better price. So things are getting better, and the major services are getting more access to this technology, and so that we can do, as I told previously, even from the first step of surgeries and the simple surgeries to the more complex cases.
Well, Dr. Nakamura, I think that's all the time we have today. Thank you so much for your valuable insights and sharing your knowledge on Brazil, Latin America, and about the state of ophthalmology in general. We really appreciate you coming on.